Good evening, everyone. I would like to present my paper entitled Factors Influencing Full Immunization Coverage Among Children aged 12 to 23 months in Chadereka Rural Community in Zimbabwe. As a brief summary, this study employed a quantitative approach to identify the factors which influence full immunization coverage among children. After conducting the study, the full immunization coverage was 64.2%, and the factors which mostly influenced the full immunization were mother's awareness and wealth status of the mother actually influenced the full immunization of children. The major reasons for failure to immunize children were alluded to as obstacles and lack of motivation by mothers. Also, we found out that vaccines which were administered at birth had a higher coverage than vaccines which were administered later to children aged 12 to 23 months, a higher coverage for the BCG vaccine versus the measles. We also found out that a significant percentage of children, 37% of them, were immunized at outreach areas of the sources of immunization. The reason why we undertook the study was because when we know the full immunization coverage, it actually tells whether the vaccination services that are offered at health centers are successful, and also uncovers the reasons why mothers and caregivers fail to immunize their children. And then, so what? It is very important in programming vaccination activities for the health centers to elicit the reasons for failure to immunize children, so that strategies which are developed to address these issues are actually tailor-made to the specific communities. This also encourages inclusive action plans at health facility level, as well as designing strategies, like I mentioned. There is also need to determine the most critical factors that affect full immunization status of children. This will also assist in tailor-making also the intervention. Several factors will come up as reasons for failure, but determining the most critical ones will also have an impact when designing immunization activities. So the results from the study will contribute towards establishing the immunization coverage for that health facility. Our system in Zimbabwe is such that full immunization coverage rates are normally given at national, provincial, and district level, let alone the health facility level. So we intended to find out the vaccination coverage, full vaccination coverage at the health facility level. So the results from the study will be used by national, provincial, expanded program immunization officers to improve vaccination activities within districts. It has been discovered that immunizing children reduces deaths to under 5s globally. A large number of children die because of vaccine preventable diseases. And in Zimbabwe, most of the studies which are done in relation to full immunization are related to logistical arrangements at the health facility level, and also at how the health system is organized. So in this study, we went on a step further to elicit the reasons for failure to immunize children at community level. This study was conducted from September 2015 to December 2015 in the named district in Zimbabwe. The modified whole cluster sampling method was actually applied to select eligible children, and the sample size was 120. Structured questionnaires covered information on physical access, health worker knowledge, attitudes and practices, missed opportunity, caregiver factors, among other factors, to elicit the reasons for failure to immunize, as well as the full immunization coverage. And then the data was then coded and entered into Excel software. A chi-square test was done to test statistical associations and p-value at 5% significance level. The results from the study showed that vaccines which are administered at birth had a higher coverage, as you can see, than vaccines which were administered later. And the full immunization coverage in Chadereka community was actually 64.2%. And so in terms of the different vaccines, you can see the coverage is going down as the age of the child increases. Then we did an analysis of the social demographic characteristics of the mothers. Then we found out that mothers' awareness and wealth status actually were statistically significant with p-values of less than 0.05. This actually shows that the more the mother is aware, the more the mother is likely to immunize the child, as well as an improved wealth status can also result in an improved vaccination of children. For the major reasons of failure to immunize, we discovered that most of the parents alluded to obstacles as major reasons for failure to immunize. These obstacles included the place of immunization being too far. Most of the parents were staying at 15 kilometers or more from the health center. And also the mothers were actually saying they were too busy sometimes to take the children for vaccination. After obstacles, we found out that the lack of motivation by mothers also to take children for immunization was another reason why mothers actually failed to take their children for immunization. They lacked the motivation because they did not see the value of the immunization process in itself and how the children were actually going to benefit from immunization. When we also looked at the sources of immunization, most children were immunized at the health center in the study sample, followed by the outreach services. Actually, 37% of the children were immunized at outreach centers, and very few were bypassing the health center to the hospital. In conclusion, maternal awareness of vaccination services offered at the health facility and maternal health status significantly influence full immunization among children aged 12 to 23 months in Chadereka community. And the reasons for failure to immunize were mainly as a result of obstacles, as well as the lack of motivation by mothers. The findings from the study actually confirm the notion that outreach centers play a significant role in complementing immunization of children in various communities. In terms of the future steps after the study, we shared our findings with the district health executive, with the program planners, and all the interested stakeholders. Then we advised them, because mothers' awareness came up as one of the key influencers of full immunization coverage. We advised the DHEs to develop strategic information, education, and communication material in vernacular language to increase awareness on available MCH services. And then we also advise the health facility staff to strengthen their outreach activities by working with community workers, by working also with different frontline workers to ensure that outreach services are properly programmed and communities are aware of what is happening where and where, because the issue of maternal awareness came out as key in the study. And then we also recommended the need to introduce income penalty projects.
Yeah, Ms. Priscilla, thank you for your wonderful presentation.